Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the implants and their integrity. For and for prosthesis is what we know. To check implant integrity, as patient wants to change the prosthesis. So this is basically as what we can see. This is the upper right quadrant. We've got a cantilever here. The upper right implant, as you can see very clearly here, a very minimal bone available around this tooth, approximately just 3 millimeters of bone in the buccal side and 3.45 millimeters of bone on the parietal side. Moving to the upper right second implant, so again here we can very clearly see we've got significant bone loss all the way to the apex. So very minimal bone available around the implants here. The ridge is quite thin. Moving to the upper anterior implant, here you can see again we've got significant no cortical plate, significant bone loss here and here. Only bone that we can see it's at the apical area. Now moving to the implant on the upper left hand quadrant, again has good cortical bone on the buccal side but minimal cortical plate on the parietal. Moving to the implant on the upper left segment premolar region, again minimal bone available around these implants, as you can very clearly see on this 3D rendering. Moving to the upper left hand quadrant, the distal most implant again is suffering from very severe bone loss. You've got bone loss on the buccal, bone loss on the parietal, only approximately 4 millimeters of bone support on the buccal and the parietal aspect. So this is the implant on the lower left hand side. Again, this implant is doing a little better than the implants on the top. You've got bone support on the buccal aspect and on the lingual aspect. You've got good bone around the implant. In the second implant, it's lingually placed, so we've got a little bit of lingual bone loss, but the buccal bone is quite significantly available, as you can see right here. Then we've got the second last tooth. Again, this implant has very good bone around it. And then the distal most implant, again, the ridge was quite lingually placed, but this implant is again placed center of the ridge and has good bone support on the buccal as well as the lingual aspect. So the lower implants can definitely experience a change in prosthesis. The upper implants, unfortunately, are not doing very well. The right side has buccal and lingual bone loss, whereas the anterior ones have parietal bone loss, and the upper left ones also have parietal bone loss. So this is the tooth from the lingual aspect. This is if we were sitting on the tongue. This is how things would look. So again, we would advise that the upper implants should definitely be assessed for change in prosthesis. Thank you very much.